Good morning, everyone. Thank you for joining today's Tele-Town
This call will be recorded.
I'm Noel Bonham, the State Director for AARP in Maine. Today, I'm delighted to welcome our special guest, Congresswoman Chellie Pingree, who's helping lead the fight in Congress to protect the financial and healthcare security of older Americans. Congresswoman Pingree represents Maine's 1st congressional district, and in a moment, I'll invite the Congresswoman to start with the opening statement. But before that, I want to cover a couple of things. Today's conversation centers on what's happening with your Social Security, a critical program that has been in the news a lot lately. This is an issue that matters to all of us, and we're thrilled to have you on the line to join this conversation with Congresswoman Pingree. As a nonprofit and nonpartisan organization, AARP has worked with every administration and every Congress to advance the well-being of all older Americans. AARP is in your corner, fighting for issues that matter to you, including protecting your hard-earned Social Security. Our Tele-Town Hall today is hosted by AARP Maine, and this is an interactive event. That's right. You may actually get in a queue and if you have a question for the Congresswoman, you may ask her directly. That means after brief remarks from our guest, you'll be able to ask your question by pressing *3 on your keypad at any time during this call. Again, all you need to do is to press *3 on your keypad at any time during this call, and you will be placed in a queue so that you can ask your question directly. So let's get started. Congresswoman, welcome to this Tele-Town Hall, and thank you so much for joining us this morning.
Thank you for having me. It's a pleasure.
Would you please open with a statement, and then we can get into the meatier questions?
Sure. Yes, I want to have plenty of time for everyone's call, so I won't spend too much time in the beginning, but I'm honored to serve Mainers in Congress. I represent the 1st District of Maine, which goes from about Kittery at the southern end up to Camden, Maine, all the way up to Bridgeton, and it includes Waterville too. So it's 125 very different towns and offshore islands, and I've had the pleasure of representing this district since 2009. I serve on the Appropriations Committee, and I'm the ranking member on the Interior and Environment Subcommittee. I also serve on the Agriculture Committee as well. So I work on a lot of issues related to the challenges that we have in Maine, but as a member of the Appropriations Committee, we are deeply in the discussions right now about how to keep the government open and how to keep the government funded. We've had over 92 hours in committee this year on markups trying to come to an agreement with the Republicans. So I want people to understand this isn't something that happens arbitrarily and overnight, but eventually came to an impasse. Our biggest concerns are related to the healthcare crisis in our country, especially Medicaid and Medicare, but also the Affordable Care Act, which many people depend on for the enhanced premium tax credits. If you're under 65 and not collecting Medicare, you may well be one of those people who will be deeply impacted by the notices that come out this month and also the decisions you have to make in November. So I won't get into other issues, but I am so happy to take any of your questions, and I'm really happy to talk about Social Security today. So thanks so much for Maine AARP and all for having me.
Thank you very much. We already have a caller, but before we get to that call, so that we can give our listeners, our audience, some time to think about it. Again, as I mentioned earlier, if you have a question for the Congresswoman, all you need to do is press *3 on your telephone keypad, and you will be placed in a queue so that you can ask your question directly. As they think of questions, I know they'd also like to hear from you, Congresswoman, about what's happening with the Social Security Administration and what you're doing to help protect and strengthen Social Security.
Well, since I was first elected and long before that, I've understood what a critical program that Social Security is. You know, a significant number of Mainers, about a third to a quarter of the state, benefits from Social Security in one way or the other, either as retirees or disability benefits. And it's just a huge part of the lifeline. Prior to Social Security, we had so many seniors who lived in poverty, who didn't have adequate retirement. and this has really been a critical part of the United States' future going forward. Now, there are a lot of concerns that people have about the stability of Social Security. I'm happy to talk about some of the proposals to stabilize the trust fund. That is critically important to me, and I've signed on to a variety of bills that would do just that, to deal with many of the issues related to going into the future, because we want to make sure that Social Security is not just there for this generation, but to our children and grandchildren going forward. During the Trump administration, there have been a variety of questions raised about Social Security. These have come up in other administrations as well, but some that I'm particularly concerned about have always been about the idea of privatizing Social Security. There are many people who have a 401k or who are invested in the stock market who take that risk in their everyday lives, but my feeling is with the government's plan for Social Security, we cannot take the risk of privatizing that, and I have always fought against that in a variety of ways. During this current administration, there have been reductions in force by what was called DOGE, run by Elon Musk in the beginning, and a variety of proposals that came out then. There's already about 10,000 person staff cut at Social Security, maybe 10 to 15,000, and there are still proposals to reduce the force there more. That has resulted in longer wait times, particularly on the phones. And during this shutdown, which is a separate issue that we're going through, there is no ability to apply for Social Security in an office or to do many of the things that people would normally expect to do in a Social Security office. Checks do continue to go out, and that's a very important, that's an important aspect of Social Security that always continues, even if the government is, quote, shut down. There have been other suggestions that have gone on in the last few months, and we have fought back against those. One was to require every parent who had a baby to actually go into a Social Security office to collect their Social Security number, as opposed to just getting it automatically. We won that fight. The entire delegation worked on that, and we've gone back to our well-working system that says when a baby is born, they automatically receive that Social Security number. There has been a change since September 30th that people will no longer receive paper checks. And if there's anyone on the call who's concerned about that or is having a problem with that system, feel free to contact my office or the Social Security office. You are allowed to apply for a waiver to continue receiving your checks on paper, and let us know if we can help with that. There's a little bit of a process to get through it. So there are other things that we're constantly worried about Social Security. I want you to know it's in the forefront of my concerns. I have an excellent team that works in my office, particularly in the Portland office, doing constituent service. And we are ready to speak to you any day on any questions that you might have, but also to help you with those difficult issues. Often applying for disability can take an extra long time. Certain situations require a certain assistance. So while we are not able to get in contact with the Social Security Administration during the shutdown, we are ready to work with you anytime. And so even feel free to call us today if you need to talk about problems that we'll resolve as soon as the shutdown is over. So it's a little bit of an overview. I'm happy to, dig in deeper on any of your in-depth questions and support any of the issues that all of you are dealing with in any way possible.
Thank you so much for that overview, and it's very helpful and sets the context for today's call really well. We have several callers in the queue right now, and I will start taking those calls one after the other. But at some point, Congresswoman, if you could give the number to call, the number for your office if people want to reach out to have further questions at some point, that'd be great. So without waiting any longer, I'm going to invite Carl from Green. You are live.
Thank you, Noel. Thank you, Representative Pingree, for taking the time out of your, what's got to be a crazy schedule, to chat with us today. You've already alluded to this a little bit, but insolvency of Social Security is creeping up on us. I've heard anywhere between 8 and 10 years. And in my most rudimentary understanding of economics, it seems to me that if expenses surpass revenue, then something needs to change, which is the problem that Social Security is having. And in this case, saving on expenses for Social Security means delaying or cutting benefits, which in my mind is a no-go, and I'm sure that's in your way of thinking as well. So that leaves increasing revenue. To me, again, not an economics student at all, the most obvious solution is to raise the taxable maximum income above $176,000 where it stands at now. Is this an oversimplification, or am I just missing something?
I don't think it's an oversimplification at all. Thank you, in fact, for putting it in such a plain way. I think we're all used to our own household budgets. You know, how much money comes in has something to do with how much money you can spend out. And that is one of the key issues that the trust fund is facing. We have a disagreement in Washington, but I'll tell you the bills that I have signed on to deal with the very issue you're talking about. How do you raise the revenue? One of the sources of the problem is that the trust funds were created in 1935. 95% of all wages at that time had payroll tax withheld, but today only 82% of wages are subject to those payroll taxes, and that disparity is growing between low and high income wages. So the proposal that I believe in is to increase the revenue coming in. Right now, payroll taxes are only paid on up to the first $176,000 in wages. So as you know, that covers almost all Mainers. We have very few people who are earning much more than that. But across the country, of course, there are many people who do. So the Social Security 2100 Act would raise or eliminate that payroll cap. And while it would still be capped at $176,000, for those who earn over $400,000, those would be taxed. So you would get those high earners would go back to paying into the system, and that would be significant in terms of the revenue. So for me, that's the most important proposal, to go ahead with that. Just to give you a little bit on the other side, Republicans have proposed raising the retirement age, which I think is problematic because especially in a state like ours where many people, they work in the woods, they go fishing, they're on a construction crew, their bodies wear out, and it's very hard to ask them to go continue to do their job well into old age. The second is reducing the benefits, which already, as you know, many people are concerned that they can't live on their Social Security check. So I think that would be a huge problem. Also, some of the plans would invest the trust fund in the stock market, and I feel that's far too volatile and unpredictable, and we shouldn't be doing that with the citizens' money, and the people who've paid into Social Security their whole lives are trusting us to maintain a solvent fund. So thanks for bringing that up, and those are my ideas about what to do about it.
Thank you very much. As a friendly reminder, for those of you who just joined our call, I'm Noel Bonham, the State Director of AARP in Maine, and our topic today is protecting and strengthening Social Security. Our special guest is Congresswoman Chellie Pingree. If you'd like to ask a question directly, you may simply press *3 on your telephone keypad to be connected with an AARP volunteer who will take your question, place you in a queue so that you may ask your question directly. The next caller is from Cape Elizabeth, and that is Jessica. You are live.
Hi, Congresswoman Pingree. Thank you so much for taking the time for this call, and I appreciate everything you do in Congress as my representative. My husband and I are both retired federal employees, been through about 4 shutdowns when we worked, and this one is different on a lot of levels. But yesterday, and we worked for the Social Security Administration, so it's quite pertinent. Yesterday, I learned that the Commissioner of Social Security, Frank Bisignano, is now the CEO of the IRS. After 35 years in the government, I've never heard of the term CEO applied to a government agency. And this type of dual role, which is happening more and more with governmental agencies, has to impact the kind of services that American taxpayers receive and beneficiaries of Social Security. And now the IRS, I understand, is on its 6th commissioner since the president has taken office this time. And the current commissioner is Scott Bessent, who is the Secretary of the Treasury. So, I mean, this is really getting kind of bizarre, and I wanted to know your take on these kind of personnel moves and how it impacts Mainers and everyone across America.
Well, thank you very much for your question. Thank you and your husband for being federal employees. We all know how hard you work, how often federal employees are under-recognized, and I hope people do understand that essential employees during this shutdown work without a paycheck. And while there is currently a guarantee that their paycheck will be returned to them at the end, we know that as shutdowns drag on, and the last one under the Trump administration was 35 days, people have a hard time making their mortgage, putting food on the table, and they all deserve our praise and support and deep appreciation. So thank you for the work you've done. Thank you also for working in the Social Security Administration. I can't tell you how much our office values working with those employees, how much you help us to help our constituents. You do a challenging job. That is a very, very complicated system. And without the experienced employees who are there, we would never be able to resolve so many of the challenges that people do face. As to your question about what I consider completely bizarre in the way this administration has staffed our federal government, you are right on all counts. Starting with the DOGE cuts and allowing Elon Musk, a total outsider, and many others who had no experience with government to come in and start dismantling agencies of government, cutting staff, laying off staff. There were people who were put on sort of a furlough where they didn't go to work and then were paid anyway. There were people who provided essential services, whether it was at the NIH or, the National Institutes of Health or FEMA or the air traffic controllers, just across the government, this DOGE entity, whatever it was, using algorithms and keywords to dismantle whole agencies of government and fire people based on sort of ideological thinking or just misguided understanding. They also allowed people, to retire, many of whom had years of experience doing the very services that we need, assisting farmers, helping people with Social Security, helping with our tax system. And now this kind of dismantling of government where, as you said, putting people in charge of Social Security who are also in charge of the IRS, putting on inexperienced people who are politically aligned with the administration. I've never seen anything like this before, and I'm just deeply concerned. Forget the partisan side of it, but just that we need highly qualified, experienced people running one of the most complicated governments in the world. And while everyone can agree that we need more efficiencies, we got to take the fat out of some of the government spending, but a lack of experience, getting rid of your experienced people, having political litmus tests about who can stay and who doesn't stay on everywhere from the Justice Department to the USDA is it's ridiculous. And so I'm deeply, deeply concerned. And we try to watch it as closely as we can, but unfortunately, there's a tremendous lack of transparency right now, and it's hard for us to get this information. But we do work at it every day, and I know it's one of my colleagues' number one concerns. So thank you again for your question. Really appreciate your work and for you bringing that up.
Thank you very much. The next caller is Suzanne from Matanicus Island, and I'm not sure if it's a question, but I think she has a request for you. And Suzanne, you are live now.
Thank you. Thank you, Chellie Pingree, for all you do. Excuse me. As an islander yourself, you know how hard it is to make a living on the island and to have a family home here and to keep going one foot in front of the other. And Social Security is very important. Just the idea of it gives us a blanket kind of to think about and to lean into. And it is very, very scary when you think that anything that you have worked so hard for can disappear in a second without any help from anyone So this is so important to Fisher families, as I know you know too. And we thank you for anything you can do for us.
Suzanne, thank you so much for calling in. Yes, I live on an island myself, so I know the special challenges that island communities face and how vital it is to keep them thriving and healthy. And I have a very soft spot in my heart for Matinicus. You guys travel the greatest distance to get home. You have the least amount of ferries to get you there. And I was out visiting, I think, just last year to see your power plant because I know you have some challenges going on there, that you're so valued to all of us in the state of Maine. You have a lot of hardy fishermen out there. You're so much a part of our history and culture and also our thriving economy. People love nothing more than the opportunity to go visit one of our island communities, particularly in the summer, maybe not on this stormy, rainy day we've got going on today, although thank goodness for the rain and this drought that we're in right now. But I thank you and the other Hardy members who continue to live there because you yourselves are doing a great service to the rest of us. You know, many people wouldn't put up with some of the challenges of island life, and we want to make sure our thriving island communities are able to continue. So thank you for the sacrifices that you and your families and the other members there make to continue that community going. I know as an islander myself that there are also many benefits to our close-knit communities and to the wonderful way of life. And for those of us who still have operating schools, to raising our children in these communities and sending them to some of the smallest schools with the best teachers in the state. So we're very lucky. But on the other hand, I know there are huge challenges. And as you said, Social Security is critical. And when you talk about fishermen, I mean, what a vital role they play in our state. They're not only, you know, of course, important to every fishing industry, from lobster to halibut to scallops and clams, everything that people fish for, but also our tourism economy and the culture that we value in the state of Maine. And we need to make sure that their Social Security is protected because retirement is important to them. And as I said, they're one of the hardest working professions out there. So raising the age, which is currently 67 up to 70, I think would be devastating to fishermen, asking them to work that many years longer or find some other kind of work, which, as you know, isn't always easy in many of our offshore island communities or in many communities in Maine, and also protecting their health care. A huge percentage of the fishermen buy their insurance on the exchange, so they're part of the families that will be making a decision in November about whether they continue to afford the cost of health insurance, so that's important too. So anyway, thanks for your call. Lovely to hear from you.
Thank you very much. If you have just joined in and would like to join the conversation, have a question for the Congresswoman, please press *3 on your telephone keypad and you will be placed in a queue so you may ask your question directly. Before I go to the next caller, we also received some questions from our volunteers, from our advocacy volunteers. And one of them is, I've heard that the Social Security Administration has closed a lot of offices around the country. Do you know if there are offices that are being closed in Maine? Are there any of the offices in Maine closing?
That's a great question. Thank you. And yes, we have heard about many of those closures around the country. As far as I know, and I will double check, we have had no office closures in Maine. We have heard about longer waits in phone time, but we have heard multiple stories of people continuing to get good service. I think the team that works in Maine in our Social Security offices does an excellent job, is always there to help people. And we, as I mentioned earlier, we have a lot of contact with them because when people do end up with a challenging situation in getting their benefits or a problem with their benefits, we often hear about it in our office. And by the way, those of you who'd like to call our office at any time about a question about your Social Security, Medicare, or anything else that interfaces with the federal government, our number is 207-774-5019. So 207-774-5019. I can give that number again. You can also go to our website, and look up. We have offices in Portland and Waterville, and of course, you're welcome to visit as well. We have an office in Washington, but in Maine, we have those two in Portland and Waterville, and we are happy to talk to you on the phone, or you can send us an email through our website. So we want to be there to help you. So I'll update you if I hear about any offices that are closing in Maine, and we would certainly fight back, because we know that there are many people who prefer to come in and talk directly. Bring in your paperwork, look at somebody face to face and say, can you please explain to me how to do X, Y, or Z? I know these systems are not simple, and it helps to have the person who's got the experience of doing it over many years. So we're going to fight to continue to keep those offices open and to make sure that your phone calls get answered. One of the biggest concerns I've heard about is longer wait times on the phone. We know that some of the people who are working in the offices have occasionally, in our main offices, have been occasionally pulled off to work on the national hotline. We worry that that's part of a downsizing of personnel, and that those cuts that were made at the federal level of thousands of people across the country will have a long-term impact on your ability to get services. You paid into Social Security, you paid for this service, and you deserve to get all the help that you need. I just want to tell you, I just got a little bit of an update from my office. We have many people who do an incredible job in our office, but Anne, who works on a lot of our Social Security issues, is a genius. She tells me there are no office closures currently, but the services are limited because of the shutdown. You're not able to get all of the services that you might have gotten at another time, but we will. I don't think you can get your cards replaced or some other things, or some of them you have to do online, but you can check in with those offices if you have a particular issue, or as I said, you can call my office. Thank you.
Just building on that, Congresswoman, another question similar to that, I just want to add, because you mentioned the longer wait times. The volunteer said, I recently had to call the Social Security Administration to update some information, and I was on hold forever. Why does it take so long to get a live person to take my call? I think you answered that already, but I think the next part is there anything you can do or we can do to make this experience better?
Well, thank you for sharing that experience, and I have heard that there are much longer wait times, and a wait time is, when you say your wait time was forever, I know exactly what you mean. When you get on one of those hold lines and you think, should I hang up? Should I stick here? Don't I have other things to do? Can I go fold my laundry while I'm also staying on hold? All those questions you ask, and the multiple ways we have to interact on the phone and get put on hold these days is always complicated. So I sympathize with that, and I believe you should get good customer service. We should have sufficient personnel. I also find it very complicated, and I'm sure many people do too, when you think you're talking just to an AI-generated voice and you're not sure they really understand what you're calling them to talk about. So you want to talk to a live staffer on that call. You want to talk to a real person. And I think continuing to fight back, one of the things we found with this administration and the tremendous number of cuts that they've been making is you just have to voice your opinion and let them know what you're angry about, whether it's calling your member of Congress, might be me, might be the second CD, or it might be one of our senators. Make the call, send in the emails. If they don't hear from you, they don't know the experiences that you're having. And with all of the challenges and complicated things going on today, this could sort of fly under the radar screen. So I just suggest that you all put in those calls and let us know any experience that you have. Anytime something happens when you're making a call or you're looking for service and it doesn't work, please let us know. We don't have any other way of finding out when these systems aren't working except to hear from you, or if one of your neighbors or friends voices an opinion and says, oh gosh, I got to tell you what happened when I tried to call Social Security today. Please just ask them to let us know, or you let us know for them, because it really does help, and we can't fight back if we don't know.
Thank you. The next caller is Riley from Sabatis. Riley, you're live.
Great. Thanks for taking my call, Congresswoman. First, I just wanted to say, as a young person, we often hear that Social Security won't be there for us when we retire, so thank you for fighting to make sure it is. I wanted to go on the topic of retirement, but other than Social Security, and ask you, what federal programs do you think currently exist or maybe should exist in your ideal world that would help young people prepare for retirement? An example I'm thinking of is here in Maine, we have the Merit Program, which sets up a required retirement program for those that are not offered through their current employer. So if you have a job, but your work doesn't offer it, it's an opt-out program. So even if you do nothing and just sit by, Maine automatically takes some of that money and sets up a retirement program for you. I, for one, would love to see something like that nationwide, but I'm interested to see what you think. Thanks.
What a good idea. Thank you for bringing this up. I really, I haven't given it that much thought, but I will say, some things I have given a lot of thought. I know that young people today often think, who cares about Social Security? It won't be there for me anyway. And I think we have to do everything we can to reinforce this program to guarantee that every young person today has the same guarantee of Social Security as those people who were born in the baby boomer generation or anybody since 1935 when it was created. So our number one priority, I think, as a representative to Congress is saying this program needs to be updated and changed and modified in such ways that we both continue to make sure that Social Security is available, that it's solvent, but also that it continues to meet the increasing costs of living. And that's an important part of the COLA that goes on every year. And we want to make sure that that is reflective of what actual costs are. So my number one goal is to keep it sacred and safe. As you've mentioned, there are fewer and fewer people who have retirement plans at work. Sometimes it's a participation in an IRA or some other system. I'm not as familiar with the Merit Program as I should be, but I'm going to look it up as soon as I get off the call because there have been proposals about required savings programs or other things to do. There are some programs now, as you know, that you can start investing in your children's or grandchildren's college costs from the day they're born or future education costs. So I think we don't do enough to think ahead. And as you have been speaking, for your generation, I think that a young person today, whether you're just getting out of college or you're in your 30s and you're thinking about, gee, I'd really like to own a house. I'd really like to have kids. I want to have some stability going into the future. We want to be sure that we're guaranteeing those things and not letting them slip by the wayside. And that's another huge issue that I'm concerned about is as all those costs rise, even if there are savings programs, for a lot of people, they're just tempted to say, I can't do it. I can't squeeze out another $5, $10, $25, $100 this month on my paycheck because housing costs are so high or my food bill was bigger than expected. So I think they all are related, but I really appreciate your idea of how can we make sure that there are those opportunities there to guarantee that you have a retirement that you can look forward to and that you can know that you'll be secure. So thanks for your question.
And thank you for your response. And to your benefit and for the listeners who do not know about the Merit Program, that is the Maine Retirement Investment Trust. That is a product of the Work and Safe legislation that 16 other states across the country have implemented and adopted. And it is a great way for someone whose employer doesn't offer retirement, and even for someone who's self-employed to start putting some money away on a regular basis towards your retirement and your financial security in the future. The next caller is Kathy from Augusta. You are live.
Good morning. Can you hear me?
Can you speak up a little louder, please?
Oh, okay. Sorry.
That is better.
Better? Thank you.
Yes, slightly better.
Thank you. And can I go ahead?
Please.
Thank you. Can you just clarify for me what is or is not included with regard to Social Security and Medicare, Medicaid, et cetera, in the interim funding bill that is being put on the side for the moment? What is and what is not included in there? I've read a lot, but I'm not 100% sure how that would impact not just me with Social Security, but the other people who are receiving benefits.
Sure. I think you're referring, let's see, I think interim funding bill. So right now, the government shutdown is occurring over a continuing resolution that would basically continue sort of the status quo of where we are right now. So that would not impact Social Security. I don't know of any proposals likely to impact Social Security that are either in our annual appropriations bill or any of the proposals that we're looking at right now. The biggest changes happened in what the president and the Republicans called the big, beautiful bill. Sometimes I call it the big, ugly bill because I don't like what it did to Medicaid. Medicaid has a huge impact on seniors, and it cuts about $1 trillion worth of Medicaid spending that would have a long-term impact on seniors and certainly in our state. So while the majority of seniors get, as you know, the bulk of their health care through Medicare, they enroll in Medicare as part of retirement, there are many things that are only covered under Medicaid. For instance, long-term care. Most people who move into a long-term care facility use up their savings in about 6 months. So anything that you had in the bank that you used to private pay is often gone by about then for many people. And then you are dependent on Medicaid. Medicare does not pay for long-term care. So that's one of the most significant areas where seniors are really impacted by any cuts to Medicaid. Another would be just the long-term impact on hospitals. So because of the deep cuts, nearly $1 trillion taken out of the Medicaid system in the big, beautiful bill, that puts a huge burden on our hospitals. Now, if you live in the Waterville area, you know that there was a recent closure of the hospital there, but in places all over Maine, hospitals have closed maybe their maternity wards or other parts of the hospital or had full hospital closures. And that's one of the most significant concerns that we have in Maine. We're a very rural state. Many of us already travel quite a distance to get to our closest hospital. To increase that would make things even more challenging. One other thing in the big, beautiful bill that was already passed by Congress, so this is already in law, it just won't kick in for a little while, is a cut into Medicare, which I won't get into the wonkiness of it, but there is a cut to Medicare in there because of the deep cuts that were made overall, and it kicks in a sort of an accounting device that requires Medicare to be cut as well. So there will be a long-term cut in the Medicare program, and we're not quite sure yet how this will all be impacted. It amounts to hundreds of billions of dollars through something called Medicare sequestration. But like I said, it's more of a sort of accounting provision. Now, these cuts could be rolled back by Congress, and so part of our negotiation is dealing with the subsidies under the Affordable Care Act, which impact people until they qualify for Medicare. Some of you, in fact, many seniors in our state are covered by the Affordable Care Act subsidies. So we're worried about the loss of those, but also we're worried about the cuts that happened in this other bill. So I know it sounds a little wonky and complicated, but it's the reason we're describing a potential healthcare crisis when you combine all of these cuts happening over the next year.
Thank you very much. If you still want to have ask the Congresswoman a question as a listener, as an member of the audience, please press *3 on your telephone keypad, and we will put you in a queue so you may ask the Congresswoman a question directly. And we'll try to get through the remaining folks who are in the queue right now. We'll try to get to as many as possible. The next caller is Bill from Rockport. Bill, you are live.
Thank you very much. Thank you, Representative Pingree. I want you to know first how much we appreciate the way in which you have been defending the rights of Americans as the Trump administration tries to turn our country into a dictatorship. My first question for you is, did I understand correctly that while the current maximum salary or income of $176,000 for withholding that you are proposing that it jump after $400,000, and if I understood you correctly, why the gap between $176,000 and $400,000? My second question is, what is the current maximum that anyone can receive from Social Security on an annual basis, and how would that be affected, if at all, on those earning above $400,000? And my only comment is that I want to credit the person who is an idealistic young American working for the Roosevelt administration actually drafted the Social Security Act, which was implemented by Roosevelt. His name was Tom Elliott, and Northeastern University Press published a short book by him about his experience working on the Social Security Act, with an introduction by Kenneth Galbraith. I turn it over to you. Thank you very much.
Well, thank you. Those are very good questions. And let me see if I can go back. So first off, you raised a question in my mind, and I know there is a reason for the gap between 176,000 and then over 400,000, but I'm not sure I can give you the answer. My good friend John Larson, who's been a longtime member of Congress from Connecticut, is the one who designed this proposal, and it's got huge support across Congress. And as soon as we're back in Washington, it's the first question I'm going to ask him, so that the next time I get asked this, I can explain for the reason for that little gap. But the other question that you pose is that the maximum benefit allowed right now, if you retire at age 70, is $5,108, so $61,000 annually. So there is a maximum. So I think your question was, well, what if you're somebody who's paying in, on your earnings of $500,000 a year, would it just continue to go up? No, that is the maximum you're allowed to receive. But I think it reflects an idea that we're often asking too much of those who earn the least in our culture and not enough of those who earn the most. So while that would not be a significant cost to many people's earnings, over $400,000, it really is a burden on those who may lose Social Security altogether or have their benefits cut. And thank you for passing along that name. I'll have to look into that. It sounds very interesting, Tom Elliott. I will look into that. And of course, you can't talk about Social Security without mentioning Frances Perkins. We're very fortunate that the Frances Perkins House in Damerscott, the home where her ancestors live, and then she went while she was the secretary, it was her home, and she often came to Maine to rest and regroup. That beautiful and historic house has now been declared a national monument, and you can visit it, and I highly commend it. It's just a wonderful sort of view into the woman who was in Roosevelt's cabinet and is credited with creating Social Security and understanding how important it was. So thank you for your question.
Thank you. And the next caller is Terry from South Portland. Terry, you are live.
Thank you. Thank you. Good morning, Congresswoman Pingree, and thank you so much for your time. Question I have is, given the history of President Trump and now some of his appointed heads of agencies and officials to engage in mistruths, falsehoods, and distortions, how confident are you that we can trust any announcements or updates that come out from the head of the Social Security Administration? I know several months ago, it might have been at the anniversary of Social Security, the administration put out some distorted information that members of the media corrected. So I just want to be sure that, in the next 2.5 years, especially as the topic of Social Security continues to come up for many people. Are you confident that we can trust the information that is on the website or is given to us by public officials associated with the agency?
Unfortunately, no. So I appreciate you raising this issue, but we have had a very hard time getting the truth or the facts out of this administration. It has the least amount of transparency that of any administration I've ever seen. And I was there during the first Trump administration, which was conducted in a very different way. So this administration has adopted a policy that they do not have to interact with Congress, Republicans or Democrats. They act much more like a unitary government, and have forgotten that Congress has the power of the purse and has oversight of how funds are spent. As you know, it's a very important part of our Constitution, Article 1 powers. It gives Congress the power of the purse, and as a longtime member of the Appropriations Committee, I have lived under both the first Trump and other administrations where all personnel changes, all budget cuts have been notice to us. We've at least gotten, if they shift funds around, if they cut funds, we have the ability to make decisions. And even my Republican colleagues don't always know that. And certainly we have had to dig up and find many of the changes that they're making. They aren't always announced. So it's one of the reasons that it seems odd, but I say it to people very often. If you see something, say something to me, let us know, because we often can't fight back on some of the things that we are worried about. And that's everything from, requiring newborn mothers to go to a Social Security office to get that birth certificate while they're still recovering from birth, the birth process, or the worries we've had about paper checks or any other challenge that you might face, any cut to your benefits, any slowdown in your benefits, any problems that you're encountering. Please let us know about it, because we are always anxious to go to our colleagues, let them know what we're hearing, seeing if it's happening in their district too, go to the press. We found many times once we let the press know and people can read about something that's going on, constituents are great. People say, hey, wait, this is my country. I paid for that benefit. I don't want you messing with it. So we are really worried about the disinformation, misinformation, flat out lies that come out of this administration. We spend a lot of time countering them. My goal is just make sure everybody has the facts. I don't mind working across the aisle with people who might have a different opinion of what should be done. We often come at this with very different views, and by compromising and working together, that's when we make the best policy. But you can't do that if you don't know what's going on. So thanks for your question, and thanks to everybody who continues to let us know what they see and hear.
Congresswoman, a somewhat connected question. I have a follow-up question connected to that. And recently, I was talking to a journalist about the change in checks and how folks are going to be asked to start receiving electronic payments. Is it true that the journalist asked a very valid question, which is, how are these people who are not online going to be informed about the change, about electronic checks? And my understanding is that they would be informed, when they receive the paper check, that there will be a notice in there about electronic checks. So I just want to reconfirm that. And the second thing is, it is also true that it will not be everyone who will be asked to transition to electronic checks, because some people just may not be able to. Is that correct? So there are two questions there.
Very good question. And again, I will double check with my office and see what we're hearing. But my understanding is that paper checks stopped on September 30th. So people should be learning now. I'm assuming, but I could be wrong, there will be a notice with the last check that says that your checks, this will be your last paper check, and that you need to make sure that you've logged in with a direct deposit number. Like, as you said, especially in Maine, many people don't have access to the internet. You might not have a bank account. You might not have everything that you need to do that. So first you'll need to set all that up. Or perhaps if you're not in a situation to be able to do that, or that doesn't work for you, you can apply for a waiver to continue to receive paper checks. We think right now the process is needlessly bureaucratic, and there's not a lot of information available to us. But if you want to contact our office, we would be very happy to help you with that and to learn about it in the process. Once again, the number for my office is 207-774-5019. So feel free to call us, 774-5019. We have offices in Portland and in Waterville. We're happy to meet with you in person or to talk to you on the phone. But I have deep concerns, and this is just the beginning of that month that we'll see the change. You should be able to get a waiver, but I don't know how difficult it'll be. And even the process of getting a waiver may require you to get online. And we're talking about people who don't necessarily have a connection to the internet. This isn't something they're frequently doing, and many people may be challenged by this. So please let us help, and please let us know what you're experiencing.
And I also want to reiterate a request from the Congresswoman, which is, the stories that actually help you understand the situation, but also be a better advocate in Congress. Is that correct?
Oh, absolutely. I can't tell you how valuable it is. And thank you to AARP for making this hour available for us. And I know it's just the tip of the iceberg of the issues and concerns that people have. But thank you so much to those of you who contact us online, who share your stories, who write my office. We get thousands of communications every week, and we screen them all. Try to respond to you, help if it's a constituent issue. We have a whole variety of people who work for us directly in our offices and are just there to help you solve your problems. But this information that we receive to you is particularly valuable in this administration, where we don't find as much information coming to us. So please, please, please continue to share that. And I would just add, even though it's not necessarily the topic of today, but when it comes to healthcare, because we are so concerned about how these Medicaid cuts will impact people, but also for those of you who use the exchange, who are going to be, renewing your healthcare insurance this month, in November, but you're getting announcements now from your insurers. We are really curious about what those announcements say. What are you hearing about how much your costs will go up? What changes will they be made to your coverage? Please call us, email us, and inform us of that, because those notices start to go out October 1st. So we know that many of you are going to just start hearing about that soon, or maybe you've already heard from your insurer. So anything you can tell us about that. If you get your health care through the Affordable Care Act and buy it on the Maine Exchange, that would be really helpful to know. In Maine, it's called Cover Me, cover capital M-E. So just like MaineCare is Medicaid, sometimes people don't know exactly what I'm talking about. But if you get your health care through Cover Me, you're getting your notices now, and we would love to know what you're experiencing.
Thank you for clarifying that. Another question that we received from our volunteers, and I'm afraid that'll give us just about time for your response and then a closing statement from you. But it's a very important question, and I apologize for the folks who are waiting in the queue that we are not going to be able to get to you today. But as the Congresswoman said, please reach out to their office directly. And I also want to mention, if you need help with making the transition to electronic checks or any kind of support that you need with paperwork, with open enrollments, you may also contact your local area agency on aging. And the entire state is covered by 4 area agencies on aging, and you can call any one of them and you will get the support you need as well. The question I have from one of our volunteers is, what can we as citizens do to urge Congress to act now instead of waiting until Social Security is on the verge of running out of money?
Thank you so much for that question. And please never discount the value of your voice. Every phone call you make, every email that you send, let all the offices know that cover you, the 2 senators and your member of Congress. If you got a cousin in another state, or your children are somewhere else, ask them to do the same kind of advocacy, because Congress really responds to what we hear from our constituents. And everyone in Congress knows that this is a looming issue. We get distracted by a whole variety of things, sometimes things that just don't matter very much. And it really helps when people push us to go back to the basics and say, you know what, this looming crisis in Social Security has to be taken care of, and you've got to deal with it. So this is a really important and helpful way for you to to benefit the work that we need to get done. I just want to reiterate what Noelle just said. Area agencies on aging do a wonderful, wonderful job in our state, and we appreciate them very much. Please go meet with them, talk to them on the phone in your area. They can help you with so many of these challenges, or also answer more of your questions. These are people who deal with these issues every day. We're so grateful to AARP for the advocacy work that you do, for keeping us informed and working alongside of us. And I am always happy to do these calls with you if there are more people who want to ask questions. This stuff isn't going away, so we're happy to continue talking to you. And once again, if you need to call our office, we have a great team, and we can help you with some of the stickier issues. 774-5019. We have offices in Portland and Waterville. And we work for you. So it's a great honor and privilege to work for you, to fight for you on these issues. And I really, really appreciate all of you taking the time to be on this call with me today, and thank AARP for doing it.
Thank you so much. We are just about out of time. On behalf of AARP Maine, I'd like to thank everyone for taking part in today's Tele-Town Hall discussion of AARP's priorities to protect and strengthen Social Security on your behalf. Our guest has been Congresswoman Chellie Pingree, and so on behalf of AARP, all of our volunteers, and the team here in Maine, I would like to thank Congresswoman Pingree for her time with us today. Thank you so very much.
Thanks for having me, and goodbye to everybody.
Thank you, and goodbye.
The AARP event has ended.
Being recorded.
Thank you for your participation in this event. At the sound of the tone, we invite you to